Hi, I'm Dr. P.K. Talwar, cosmetic surgeon. Uh, I have been doing cosmetic surgery for last 28 years, and we were among the first ones who introduced laser hair removal in India, and then um, lasers for birthmarks in India. When we talk about the birthmarks, the lasers for birthmarks, so there are basically commonest are two kinds of birthmarks. One is black birthmarks, like you see nevus of Ota or Becker's nevus, and second is vascular birthmarks, like port wine stains or then uh, port wine stain that is very common, or it is also known as hemangioma. Hemangiomas are different kinds, and different kinds of hemangiomas are treated by different lasers like pulse dye laser, long pulse Nd:YAG, etc., etc. Now, coming to the first part, that is the black birthmarks. So, commonest which we are getting is nevus of Ota. In this, there is pigment on the one side or both sides of faces in certain cases, and even in the conjunctiva. This can be very disheartening to a patient. When I introduced this laser initially in I think 2003, I had a young beautiful lady who had the birthmark on the face, one side of the face, and she was around 30 years of age. But by the time she came to me, she was already divorced because of the problem of the birthmark. We gave her 10 to 12 sittings, and this birthmark, Nevosavota, 95% or you can was gone, and she was very happy. Only regret she had was that Dr. Talwar, I should have come to you earlier. But then I told her that no, it's not possible because the lasers have come recently. So even if she had come to me earlier, we could not have done anything. So that is one of the cases which still I remember because it was my one of the first cases, and I think best possible results. The patient is very grateful, and now we have been treating this kind of problem very commonly, Nivasavota, and the results have been very good. The same lasers, that is actually this is a Q switch laser, the black pigmentation. Now this same laser can be used for freckles, for removal of the tattoos, and uh, uh, and this Becker's nevus, etc. The other birthmark is vascular birthmarks, which we call it port wine stain, and the pulse dye laser is used for that. Uh, Q switch is for black pigments, pulse dye laser is for the vascular or the red birthmarks. Now, the difference between in these lasers are that the wavelength is different. Pulse dye laser is one of the most expensive lasers to buy and most expensive lasers to maintain. But the results are very rewarding with pulse dye laser. Other modalities are not as good as that. But pulse dye laser is the treatment for port wine stain or red birthmarks. And we can expect in such cases 70% improvement. We had many patients who have got it done, and they are very grateful. We can do rosacea, rhinophyma, or facial veins, spider veins, etc. We can treat them, and patients are really very happy. So I think the medical science is evolving, and the day will come when we will be able to treat even 100% of such patients. And I suggest strongly that don't go to quacks, because I had a patient with a red birthmark, and she went to a quack, and he applied some sort of acid or what, and they burned the whole skin. Go to a qualified plastic surgeon or a qualified dermatologist who is having pulse dye laser. Then only you get it done. Otherwise, no. And the best wavelength for that is pulse dye laser is 595 nanometer. Thank you very much.